Hello guys, have you ever heard of arteriosclerosis before? In a previous video, I made mention of arteriosclerosis being a major cause of TIA or mini stroke. Well, and I promised you guys that I'm going to make a full video about what arteriosclerosis is. Now, it is here. Let's get into the video. Now, someone may ask, what is arteriosclerosis? Well, arteriosclerosis is basically a chronic inflammatory disease that occurs by narrowing and then hardening the arteries. The arteries are blood vessels that carry fresh blood or oxygenated blood from the heart to all parts of the body. So it distributes well refined blood that is oxygen rich to the body to play major roles. When that blood vessel is at fault, you should know what's going to happen. You're at a high risk of having other conditions, okay, which might be dangerous to your health. Now, do you know this condition is actually one that occurs when there is the hardening of the arteries? Talking about the arteries, as I said, they are blood vessels that carry oxygen rich blood from the heart to all parts of the body. So it is a leading cause of heart disease. Okay, it also causes stroke and then sometimes even leads to death worldwide like this. So this condition called arteriosclerosis causes stroke, it can cause death worldwide, and then even cause some heart diseases. But do you know something? There is a good news for all of us here, that this condition is largely preventable. You can prevent it. So as you watch this video, I'm going to give you some preventive tips as to how to prevent it. Okay, I want everyone to live for long, and that is very, very key to our health. You live for long and then you live healthy. Okay, so in this presentation we will explore what arteriosclerosis is, its risk factors, and then most importantly how to prevent it, and then manage it. So let's get into the video. Now, what are some of the risk factors then? Well, the risk factors, I'm going to split them into two, and they are as follows: both modifiable risk factors and the non-modifiable risk factors. So the reason why I'm splitting this into two is because with the modifiable risk factors, they are factors that can be controlled. You can prevent that. But then the non-modifiable ones are the ones that you can't do anything about. It is there and can't be controlled. So let's move into the modifiable one before we come to the non-modifiable one. So the modifiable one, first one has to do with smoking. You can quit smoking. So when you smoke, you vape, you take weed, you are at a higher risk of getting this arteriosclerosis, this deadly condition. Followed by hypertension, that is when you have high blood pressure. You can still control this one. And then when you have diabetes, you are also at a higher risk of having this condition. The next one has to do with when you have high cholesterol, you are at a higher risk of having this condition also. When you are obese, you are at a higher risk of having this condition. When you are physically inactive, or when you are inactive physically, you don't involve yourself in physical activities, and then you don't involve yourself in aerobic activities, you are also at a higher risk of having this condition. And then lastly, poor diet. When you don't eat well, you eat late at night, you don't take balanced diets, you are at a higher risk of developing this condition called arteriosclerosis. Now let's move to the non-modifiable ones, the ones that you have nothing to do, you can't control. These factors are as follows: your age, okay, family history, ethnicity, and then the gender. Now let's move into one key section of this whole thing that we are talking about. Prevention is key. Okay, this part has to do with how you can prevent this deadly condition. People say, there is a saying that goes this way: prevention is always better than cure, right? So, and then I think it's true. You need to prevent rather than you curing. Okay, so the first thing that you need to consider is healthy diet. You need to eat well. Discuss this with your dietitian, so your dietitian will design a nice and then a favorable and then a well personalized diet plan for you, so as to prevent you from developing this condition. Okay, and then as a result, when they develop this diet plan for you, your chances of getting this condition is slim. Okay, yes, rather than someone who does not have a healthy diet plan. The second thing you need to consider as a preventive measure is to involve yourself in regular exercising. You can seek for professional advice is talking about the exercise prescription from a licensed physiotherapist. Not forgetting, the dietitian should also be a licensed dietitian. Alright, so the third thing is to focus on stress management. You can still design a nice stress management plan also from your therapist and then your counselor as well. A licensed therapist and then a licensed counselor as well. The next thing that you need to do as a preventive measure is to stop smoking, stop vaping, stop taking shisha. These things are very dangerous to your life and then can cause this condition to set in. And then finally, stop drinking alcohol. You think I've forgotten? Alcohol intake is also another deadly one that can cause it. So do not be taking alcohol. A word to the wise is enough. Now, let's move into the next section. Now, I just want to say this before I forget. You need to take action. Okay, before it is too late. First of all, one thing you need to do is to have regular checkups. Okay, don't be sick before you go to the hospital. Go to the hospital maybe once in a blue moon, maybe once in a month for regular checkups. Discuss it with your physician to go through your system to realize and then check if your heart, the activities of your heart are actually in place. So when there are loopholes somewhere, they know how to treat it earlier before the symptoms may exacerbate. The second thing you need to consider as part of taking action is to monitor your blood pressure and then your cholesterol. Okay. The third thing is to stay informed and then educated. If you realize you are unclear about certain things, try as much as possible to go to the hospital, clarify it from your physician, clarify it from your physiotherapist, a licensed healthcare professional, so things become clear to you. Is that clear? Now, let's move to the next section. In conclusion, arteriosclerosis is a preventable condition, just as I said earlier, and then it can be managed as well. By making healthy lifestyle choices, and being aware of risk factors, the risk factors that I made mention of being modifiable and then non-modifiable risk factors, you can take control of your heart health. Isn't that beautiful? So guys, I have a final thought for you guys, and this ends the video. Remember, prevention is key. Take care of your heart and it will take care of you also. Okay, thank you so much for watching. Remember to subscribe, like, comment and share, and don't forget to give me a feedback based on what I have said. Don't take these informations lightly. A word to the wise is enough. See you next time in the next video. Bye.